Okay, so I just wanted to talk to you guys for a quick second about some corruption that's happening within the medical industry and the pharmaceutical industry. I know that there's a lot of stuff like doctors dispensing prescriptions to patients that don't really need it, or doctors being caught for selling prescriptions, or patients being caught for abusing their prescriptions, whichever the case. Now, I know the government has put out a new policy that's called patch for patch, and it's for a narcotic drug called fentanyl. And a lot of cancer patients are on this medication. Now, this whole patch for patch idea or plan was set out not even by a person that knows the proper medical field or proper medical industry, but it was actually put out by the police commissioner. And it's causing a lot of havoc and it's causing a lot of outrage with cancer care patients that happen to misplace the piece of paper. So what happens is, normally you would go to your pharmacy and you would pick up your prescription, go home, do your medication as recommended, go back and to fill a prescription. Now what you have to do with the patch for patch program is every patch that you put on, you have to take off and put on a sheet of paper. So if anything happens where you lose that piece of paper, you're screwed. That means that cancer care patient is not going to be able to pick up their medication. Now, a lot of patients out there have misplaced the documented piece of paper, or happen to misplace whatever, but they couldn't get their prescriptions released. Now that's not right. Now, when you are a cancer care patient that needs a medication, that is a totally different circumstance than a junkie coming into a pharmacy trying to get a med. I'm sorry, but if you work in the pharmaceutical industry and you're a pharmacist and you can't tell the difference between a patient that needs it and a junkie off the street, then you shouldn't be working in your profession. Okay, that's number one. And number two, it also states on the original document that outlines the rules and regulations of the patch for patch program. It also outlines that if it ever comes to the point where a patient has lost, or a medical care patient has lost that form, then the pharmacist is then to determine whether or not to dispense their prescription to them. How the fuck is that okay? I don't get that. That was a drug prescribed by their doctor because of their medical issues. So who is it to the pharmacist to decide whether or not that person needs that medication? If that person didn't need that medication, they wouldn't be on that medication in the first place. So why don't you just stick doing your job? You count pills and you work behind a counter, you're a fucking pharmacist. You don't have a medical degree. You don't have a doctorate degree. You don't know anything to have to do with the medical issues with people. So why don't you just stick to your job and give the people their medication that they desperately need? Because a lot of cancer care patients out there are suffering right now. And I don't believe that that's right. And I wish for Anonymous to look into the medical care industry, because you know what? There's a lot of corruption within them too. So that's my first.